Hi, welcome. It is May 20th. This is a live broadcast from Mount Pleasant, Texas at Titus Regional Medical Center. My name is Dr. Lance Walsh, and I want to present to you the erectile dysfunction diagnosis and treatment. I encourage you to ask questions, lots of them, during the discussion, or I'd talk to you about it. But prior to that, if you can just send email or write your questions down and save the questions to the very end for the discussion. I've got a short presentation to go over with you. It talks about erectile dysfunction. Bobby, you want to cue it up? Immediately after the presentation, we're going to have patient advocates, Rudy and Angela. They're going to present their experience with the penile prosthesis, and we're very lucky to have them on. They'll also provide you with their contact information should you want to reach them directly. Okay, so this is a quick housekeeping slide. Please make sure your browser is up to date. If you are using Internet Explorer as a web browser, it will require a plugin installation. Please turn off your mics. If you have questions, please type them in. Each of your questions will be answered or addressed during the Q&A portion at the end of the webinar. If you are signing in from a smartphone and only see a chat section, there's a drop down in the upper right corner to switch to slide deck. Troubleshooting with audio or signing in, you can dial in with your phone. Make sure your browser is up to date, restart your computer, remove firewalls or email. All right, and a quick introduction for myself. I am a native Texan, 5th generation. I trained at Texas Tech for medical school and UT Southwestern in Dallas for residency before moving to East Texas. 2 years ago, I was in Palm Springs, California for 15 years. In a large private practice. We set up a state-of-the-art facility in Mount Pleasant where we do the latest treatments for prostate cancer, bladder cancer detection, and importantly for this talk, erectile dysfunction. So today I'd like to talk about what is erectile dysfunction, what causes it. Importantly, how can erectile dysfunction be a health indicator, and then review the different treatment options for erectile dysfunction. And then afterwards, Rudy and Angela will give you a brief presentation and encourage any questions that you may have, and then we'll open it up questions for all of us. So what is erectile dysfunction? Erectile dysfunction is a consistent inability either to achieve or maintain an erection that's sufficient for sexual intercourse. Now, it could be a total inability to achieve an erection, or it could just be inconsistent. Ability to achieve an erection that's risen enough for penetration. Facts about erectile dysfunction. If you have this condition, you're not alone. There's about 30 million men in the United States that suffer from erectile dysfunction. 1 in 4 men experience some form of erectile dysfunction. And interestingly, most men with erectile dysfunction will still have the ability to have an orgasm and father a child. But others have difficulty doing these things because they can't get or sustain an erection. So even though erectile dysfunction is associated with age, it's not normal, and by no means is an inevitable consequence of aging. In most cases, this treatment can be treated and overcome. So what causes erectile dysfunction? Well, research shown that it's really not in your mind. There is a general physical problem or disorder that causes it in more than 80% of men. Once identified, we can initiate treatment that can help you return to a satisfying sex life. So examples of disorders that can cause erectile dysfunction include brain or spinal cord injury, diabetes or heart disease, operation like prostatectomy or radiation for prostate cancer, substance abuse. Importantly, if you have erectile dysfunction, this may be a sign of coronary artery disease, or that you may develop coronary artery disease. The idea here is that atherosclerosis affects all the arteries in the body, and the penile arteries are smaller than the coronary arteries. So it makes sense that you'd get blockage in the penile artery be more significant before you get coronary artery disease. And this could be an early marker for cardiovascular disease. So anybody that has a new onset of erectile dysfunction, you should see your primary care physician or cardiologist to get your heart checked. Risk factors for erectile dysfunction include chronic diseases like high blood pressure, diabetes, depression, medications that are used to treat those conditions, especially high blood pressure, including thiazide diuretics and beta blockers, and also lifestyle. Stress can affect your ability to get erection, alcohol abuse, and also smoking as well. So lifestyle changes can be effective. Another common risk factor for erectile dysfunction is aging. Aging does increase your risk for erectile dysfunction for several reasons. One is a progressive decline in sexual physiologic function, increased prevalence of chronic diseases, psychological issues, and relationship and partner issues. Interestingly, the most frequent reasons for office visits to primary care physicians with men between the ages of 45 to 64 include high blood pressure, diabetes, general medical examination, and problems with lipid metabolism. If we look at some common risk factors for erectile dysfunction, diabetes, and hypertension, factors impacting erectile dysfunction in patients with diabetes include increased age, increased duration of diabetes, poor blood sugar control as measured by hemoglobin A1C, and complications of diabetes, either neuropathy or peripheral vascular disease. In patients with hypertension, almost 70% reported erectile dysfunction, and almost 50% reported severe erectile dysfunction. In this study, the erectile dysfunction prevalence was correlated to the underlying vascular disease. So again, erectile dysfunction is not in your head. Most people, it's a vascular problem, and there are excellent treatment options. Okay. What are some other risk factors for chronic disease? You can look, diabetes, we talked about that. That has one of the highest increased risks of getting erectile dysfunction, more than 4 times. Prostate disease, almost 3-fold. Peripheral vascular disease, 2.5-fold. Cardiac problems, almost 2-fold. And then you look at high cholesterol and high blood pressure. A lot of these factors are lifestyle related, but then again, some of them are genetic. And so making sure we have those under control to the greatest extent possible can help you maintain a satisfactory sexual life. Other risk factors, prostate cancer, not so much cancer itself, but the treatments for it. Radical prostatectomy, one or both nerve bundles may be damaged, leading to erectile dysfunction. And then radiation therapy can lead to damage to the blood vessels, the penis, and that prevents blood flow. Smoking increases the risk of moderate to complete erectile dysfunction by 2-fold. The association between smoking and erectile dysfunction is likely due to impairment of the endothelium-dependent smooth muscle relaxation in the corporal cavernosa bodies, the bodies that get the erection. The lower prevalence of erectile dysfunction in former smokers compared with current smokers. So this indicates that that cessation of smoking can have a positive impact on your sexual function. And again, we talked about thiazides and diuretics and beta blockers as also culprits for causing erectile dysfunction. So let's talk a minute about how the normal process of erection occurs. An erection is an involuntary reaction in response to a sexual stimulant and excitement. The sexual stimulation causes the brain, nerves, the heart, blood vessels, and hormones to work together to produce a rapid increase in the amount of blood flow to the penis. You can see in the bottom left, there's a sagittal section, and you can see the flaccid penis, and the artist made pains to show the different arteries and veins going to it. On the right is a cross-section of the penis, and what you see are the 2 corporal bodies. They look like eyes, and the urethra that looks like a mouth. Those corporal bodies are paired bodies that are expansile, and they're filled with blood vessels. An erection occurs because blood becomes trapped and held in the 2 spongy chambers, the corporal bodies, that are in the shaft of the penis. As that engorges with blood, the emissary veins that go from the corporal bodies out to the vessels, get compressed, and a rigid erection results. So what are the treatment options for erectile dysfunction? Oral drug therapy, most people have heard of Viagra, a little blue pill. Other ones include Cialis and Levitra. These medications are inhibitors of the phosphodiesterase enzyme type 5. And so they work indirectly to maintain, to achieve an erection. You have to have sexual stimulation for them to work. Because they all have the same mechanism of action, generally switching from one medication type to another is not likely to be more effective. The reason why you have different ones, and it's a benefit, is they tend to have different side effects. For instance, Viagra can cause blue vision, Cialis can cause muscle cramps. So if you're having a good response from one of the medications but have an intolerable side effect, you can switch to another medication. They also have different half-lives. Viagra typically lasts 8 hours, for example, whereas Cialis can last about 36 hours. These pills help achieve erections in response to sexual stimuli. They won't work if you're not in the mood. You need to take them at least a half hour to an hour before anticipated sexual activity. A problem with them is that they don't necessarily work 100% of the time. And this can obviously lead to performance anxiety, which is counterproductive when you're trying to have a sexual encounter. Potential side effects include headache, facial blushing, upset stomach, mild and temporary visual effects, and back pain and muscle aches. The second treatment option is penile injection therapy. There's different forms that this can come in. One of the forms is called EDEX, which is single prostaglandin injected. There's another form that's trimix that generally you can get at compounding pharmacies that include phenylephrine, papaverine, and prostaglandin. The concept is that you inject the medicine at the site of action. These medications cause vasodilation, thus leading directly to an erection. So in contrast to the oral medications, which work via second messengers and indirectly, these medications cause direct vasodilation and erection. The other difference is that they're not systemic. That is, you inject them at the site of action, so you generally don't get the facial blushing, headache, and other side effects that the oral medication can give you. On the other hand, you are injecting your penis with a needle, so that's not as easy as taking a pill. So the advantages of the injection include onset of erection is typically more rapid, between 5 to 20 minutes. Disadvantages, there's always a risk if you inject too much that you can get a painful erection that lasts too long. That's obviously not good. People joke about it a lot, but the reality is that if the erection lasts more than 4 hours, that blood that's trapped in the corporal bodies does not have oxygen. And if the tissue is not receiving oxygenated blood, then generally the tissue will die, and it can scar. So that's a real problem. So the bottom line with doing penile injection therapy is you start at a very low dose and you titrate it slowly. You don't do more than one injection in a 24-hour period and no more than 3 injections per week. Generally, you alternate the sides because of the injection, because the papaverine component in it can cause scarring, leading to penile curvature. In addition, the prostaglandin component can cause penile pain on injection. Normally, when we prescribe this medication, we'll send it to the compounding pharmacy or a typical or a regular pharmacy if it's just the prostaglandin only. You'll pay for it, you bring it into our office, and then we'll show you how to use the injection. Vacuum erection devices, these are medical grade pieces of equipment, so not what you'd find at the novelty store. They're cost effective, safe, but they're kind of big and bulky. People that try the vacuum erection device generally describe the erection as not physiologic. It tends to be cooler. That is, the temperature is cooler because the vacuum is creating the erection. And then oftentimes a ring is placed at the base of the penis in order to maintain the erection, and that can be uncomfortable. The advantages, though, is that it is cost effective. This device will last a long time. It's safe and effective. Disadvantages: penis isn't warm to the touch. There's a learning curve, and especially with sizing the ring that goes on the base of the penis. And ejaculation can be affected, especially by the ring that's placed at the back of the base of the penis. I kind of added this slide for the sake of completeness. It's not used that often, but there is a medication that's a urethral suppository that's inserted in the urethra, and the pellets release that dissolves and increases blood flow, creating the erection. Why would you choose, a transurethral system? Well, you could try the oral medicine. It may not work. You may have contraindications of specific oral drugs or adverse reactions. But as you might imagine, most people don't like putting a tablet in their urethra. I could see how that could be a problem. So it's not, as a result, it's not used that frequently. In terms of the surgical options, there are two excellent surgical options. One is the malleable penile prosthesis. The other is the inflatable penile prosthesis. These have been around for almost 45, 50 years and have been through multiple iterations and improvements over that time. The malleable is straightforward and easy to use. Generally, we use malleables for men that have poor dexterity and can't operate an inflatable penile prosthesis. Very simple device. They're put in via a small incision in the scrotum into the corporal body, so it replaces the vascular tissue that's not working anyway. And when not in use, it's bent down. And when it used for erection or penetration, then it bends up. The disadvantage of this is it can be kind of bulky and stays firm when not in the erect position. Finally, the Cadillac or gold standard treatment for erectile dysfunction is the inflatable penile prosthesis. Folks, this is really easy to use. It is a simple mechanical device. It includes cylinders that are implanted in the penis via a small incision in the scrotum, a pump that goes in the scrotum. You can't really see it. It's like a third testicle, and then a reservoir that goes in the abdomen. And it works. It's a simple mechanical device. You press the pump, and it transfers fluid from the reservoir to the cylinders, and that erection lasts for as long as you want it to. There's no problems with performance anxiety. This thing's going to work. And when you're done, you press a little button at the very top of the pump and then squeeze the penis to mechanically transfer the fluid back to the reservoir. So as you might imagine, this is all completely inserted inside the body. It's totally concealed. No one's going to know that you have it. It's going to be, it has more of a natural flaccidity compared to the malleable implant I just talked about. It acts and feels more like a natural erection. It expands the girth of the penis, and it's feels softer and more flaccid when deflated. Studies have shown that's greater than 95% patient and partner satisfaction with this device. This is a short animation that's going to go through how to operate the inflatable penile prosthesis and also inflate and deflate it. Here's an example. You see the two corporal bodies in the penis, reservoir that's in the abdomen or in an ectopic location in the abdominal musculature, and the pump that's in the scrotum. As you can see, it's all contained, self-contained and implanted inside. To achieve the erection, generally we put the pump in where the dominant hand is. You squeeze the pump to get the erection. Looks like a normal erection. When you're done, you press the top of the pump. There's a button there, and then you squeeze the penis, and that's going to transfer the fluid back to the reservoir, and you can nicely see how that reservoir fills back up. Very simple mechanism, very simple device with 50 years of engineering behind it. Let's talk about the risk of penile prosthesis. Any surgery, there's a risk of bleeding, infection, damage to surrounding tissues, need for additional procedures. With a penile prosthesis, the risk of infection is low. There's a risk of device malfunction. And, once we place this prosthesis, you don't have any more vascular tissue because this is what it replaces. So it may make natural erections and other treatment options impossible. There's risk of erosion, migration, and chronic pain, as with any surgery. The important thing to understand, most insurance companies will cover an inflatable penile prosthesis or an implantable prosthesis, whereas most insurance companies don't cover the pills, the shots, the vacuum pump. And so we have a team at our office that can help with coverage options for this should you desire it. So we want you to learn more. You can go to www.coloplastmenshealth.com or labombita.com. There's additional information on a variety of topics, including Peyronie's disease, male urinary incontinence, testicle implants, other erectile dysfunction treatment options. There's also a link to, you can schedule an appointment to talk to a patient educator and find a urologist like myself that specializes in erectile dysfunction near you. And this also provides important insurance coverage information. And with that, I'd like to introduce again Rudy and Angela. Thank you so much for agreeing to participate and by sharing your story with us. And thanks again for being available to answer any questions if they want to call you afterwards via phone or in the Q&A session.
Good afternoon. My name is Rudy Herrera, and I'm here to share my story with you as far as the penile implant. Like the doctor was saying, I did try everything. I tried Viagra, I tried Cialis, I tried the injections. Unfortunately, Viagra would not work until like 2, 3 in the morning. By then, my wife was like, you know what, I'm asleep, leave me alone. It's not time right now. The injection, it's not as bad as it sounds, but it's very hard to travel with. What I understood from the pharmacist, you have to keep it frozen. So if you're traveling, it's not very convenient. So we tried this for everything for, I guess, about 1.5 years. Finally, I spoke with my doctor and we said, what about the penile implant? And then we discussed both. I decided to go with the inflatable. It's been 4 years now since I've been blessed with this penile implant. It's changed our lives immensely. We now feel like we're back in our teens, like 19, 20, but in a sense, it's even better than then, because back then, once you ejaculated, that was it. You rolled over, went to sleep and said, okay, I'm done. I'll be back later. Well, now it doesn't go down until your partner says, okay, I am done. And that's when you'll be able to deflate it. It's been a great change in our lives, even though your wife is going to sit there and say, oh, it's not that important. There's other things. But once you do it, you'll realize that it is very important to your wife. They just don't want to make us feel incompetent, or they don't want to make us feel bad. That's the bottom line. But once I got it done, thank God, it has been a blessing. I do have my number up there. If you guys have any questions, feel free to call me or email me. I do work, so if I'm at work, I don't answer, please leave me a message. I will get back to you. Like I say, it's been 4 years for me now in March, and it's been 4 great years. Before that, our lives together were great, but now it's awesome. So my wife is going to share her side with you guys, and if you have any questions, please call us.
Hi, my name is Angela Herrera, and when we started seeing that there were difficulties in our sex life, we started looking at different options, and obviously the pills were the most convenient, at least we thought, but they don't really work that well. Sometimes it takes long. Sometimes you don't get the full erection. So we were having problems there. He went back to the doctor. They gave him other things to try. And then they gave him the injection. And to me, just seeing him inject his penis was kind of like, whoa. But yeah, you do have to be very careful with it. If we would be traveling and we thought it wasn't frozen enough or something, we would throw it away. We were afraid. And honestly, we were afraid of getting different medications into his body. I just thought that just can't be right. So we kept looking for options. His doctors spoke to him about this. And at first, I mean, surgery was like, whoa, that's a big step. But he was very insistent, and I'm glad he was, because my attitude was more of, it's okay. I mean, we can cuddle, we can do other things. I mean, we're old, although we're not. But so we started kind of looking into it and being serious. And he said, I really want to do it. I want to make sure that we still have our golden years and be able to have an active sexual life. That was important. So we went on ahead and he went through the surgery. It took about half a day, and then they left him there. He had to stay there overnight. The next morning, I picked him up. It was painful the first week. The second week was a lot less painful. And by the third week, he was able to move around, walk around, although they had told us not to do anything until after 6 weeks. And we were really good about it. When he went back for his checkup and the doctors told him, you're good to go. And I was pretty impressed by it because I really didn't know what to expect. I mean, they didn't have all these seminars at that time, so we didn't know what to expect. And I mean, like you said, it's been 4 years. It's been great. We have a pretty active sexual life. We travel and we can do whatever we want and not have to carry extra stuff or anything. It's there with him. So you don't really feel the difference. There's no difference in it, really. It's the same. You don't even really feel the little extra testicle that they say. I guess it gets lost among the other ones. But I don't see the difference other than once he ejaculates, he can continue with his erection, and we can continue until we're both satisfied at that time. So it's been a great experience. I really, really recommend it. And I know it's a tough decision, but it is really worth it for yourself, for your partner, and your relationship. And I am available if any wives want to call me, if they have any other questions, or the men want to know how it is from a women's perspective. I'm available. You can call me. I can pick up while I'm at work most of the time. So I welcome any calls. Thank you.
Thank you very much for your presentation and sharing with us. Now's the time we can talk about any questions.